One group of plastic surgery patients that we didn't see 10 years ago are patients who have undergone bariatric procedures or have lost massive amounts of weight. These patients have their unique set of problems, but virtually all of them need some degree of a body lift. This is a procedure that really didn't exist 10 years ago when we did standard abdominoplasties, but now procedures like belt lipectomies, where we do 360-degree tummy tucks, are commonplace. These procedures are done as an outpatient, and the patients can't believe the difference that they see in themselves after undergoing these procedures. Patients also sometimes have to undergo thigh lifts, arm lift procedures, or even facelift procedures after such massive weight loss. Because of the length of these procedures, which can sometimes be long, we try to stage them into multiple procedures. That really is done primarily for the safety of the patient. We don't want to expose them to any undue risk associated with prolonged procedures. But oftentimes, multiple procedures can be done together. For example, a thigh lift and an arm procedure could be done at the same time. In the same way, we typically would do a belt lipectomy, a 360-degree tummy tuck, as a single procedure, because that really is a long operation, which is going to require significant recuperative time for those patients. As with any surgical procedure, a procedure of the magnitude of a body lift is going to result in some swelling and the need for drains postoperatively. Oftentimes, these patients will need to keep their drains in place for several weeks as the amount of fluid diminishes. Patients also sometimes have swelling, which limits their ultimate result, but oftentimes that swelling is gone in a period of 4 to 6 weeks. Those patients are often also kept in compression after the surgery, and that means that we put them in a suit, which helps the skin to remodel and take the ultimate shape that we want it to take. We'd be glad to talk to these patients about the options that are available to them, and many times these patients are surprised at how cost-effective these procedures are when they thought that they would be much more expensive.